Excited about our Empower conference. That's gonna be cool.
We're going live. All right, good afternoon, everyone. I have 1 o'clock. This is Ron Aiken. I am the Media Relations Director for the South Carolina Department of Public Health. And I welcome you all and thank you for joining this measles briefing here on Friday afternoon. In a moment, I'm going to turn it over to Dr. Linda Bell. She's our state epidemiologist. As I continue to admit people, we have a lot of folks on the call today. At the end of Dr. Bell's remarks, we'll open it up for your Q&A session, at which time I'll ask that you raise your hand virtually, and then I'll call on you in the order in which those hands are raised. And at this time, I will go ahead and turn it over to Dr. Bell. Thank you.
Thank you, Ron, and good afternoon, everyone. I thank everyone for attending this briefing today on the measles outbreak that we're having in the Upstate. The latest information that we have to provide is that as of noon today, we have confirmed an 8th case of measles related to the ongoing outbreak in Spartanburg County in a child in Greenville County. This makes this the 11th case in South Carolina this year. At this time, it is too early in the investigation of the most recently reported cases to be able to say whether it is linked to the other known cases through shared exposure. And our efforts at this time are ongoing to identify potential exposures, and subsequent notifications, if necessary, will be made to any close contacts or those at risk who are identified. So currently there are 153 students who were exposed contacts without immunity at the 2 schools identified yesterday. That is Global Academy and Fair Forest Elementary School. Those schools are following the protocols to exclude these students until the period of potential disease transmission has safely ended. Those students are identified as having been exposed and not having been vaccinated, and that's the reason for the exclusion. The Department of Public Health has been working closely with officials at each school through this outbreak, and both schools have been very proactive in taking the recommended precautionary measures to ensure that the students, the teachers, and staff are safe, and those measures will help us be very effective in preventing the spread of measles virus in those schools and in our communities. But what this new case tells us is that there is active, unrecognized community transmission of measles occurring in the Upstate, which makes it vital to ensure that the public have received the recommended measles vaccinations. It's important for people to understand that the virus can be spread through the air when a person with measles breathes, coughs, or sneezes, but the virus can also remain active and infectious in an airspace, in any confined area, in a room, a hallway, or in a vehicle for as long as 2 hours after the sick person is gone from the area, which makes it so highly transmissible. Increasing protection against measles is critical to our ability to stop spread in South Carolina. The measles vaccine that is currently being used, that is available now, is the same vaccine that resulted in the successful elimination of measles from the United States 20 years ago. In fact, the measles vaccine is over 97% effective in preventing infection, meaning that the majority of people who get vaccinated get lifelong protection against measles. The recommendations for the measles vaccine include that children should receive 2 doses of the measles, mumps, and rubella vaccine that we refer to as MMR. They should receive the first dose at 12 to 15 months of age and the second dose at 4 to 6 years of age. Children 6 to 12 months of age should get an early dose of the MMR vaccine if they are traveling internationally or if they're in an outbreak area. And with that updated information, I'm happy to take any questions you might have. Thank you.
Thank you, Dr. Bell. Lauren, go ahead with your question.
Hi. Can you, during the briefing, I think it was on Friday, you were talking about vaccination rates that fall below 95%. Can you be specific about what the rates are at these 2 schools?
So the vaccination rate at the school level, I do not have that information readily available, but what we do know is in the upstate area in general, which is most important because the way this virus is transmitted is not as important as that very localized area. When we identify close contacts, it's important for our understanding of who needs to be excluded. But when we look at a county or a regional level, it's important to understand that we estimate that there's only about 90% coverage in that county area, and that is below the 95% level where we seek to achieve what we call herd immunity to get the best population protection for a virus that is as highly transmissible as the measles virus.
Thank you for that question, Lauren. Go ahead, Skylar.
Hey, can you tell us a little bit more about how and when parents at these schools were notified?
So when a case is identified in a school setting, as soon as we make that confirmation of where someone who is actively infected has been, we work with the school officials to get the information about how to notify the parents. We will send and have sent a letter to the entire school community notifying them that a case of measles has been identified in school. And in addition to that, we'll send other information to those who are defined as being exposed. That could be somebody who's a close contact, or as I mentioned, with the potential transmissibility in an airspace after the infected person is gone. We also evaluate who has been in those airspaces and could have been potentially exposed. And we provide letters to them specifically notifying them that they are exposed. And then we evaluate who among the exposed are unvaccinated and susceptible to infection. So in short, letters are sent to the entire school body as soon as we can work with the school officials to give us that information. They have been working well with us using their means that they have to notify parents by email, and that's primarily how we rely on the schools to get the information to the school community.
Is it Urena Ray or Ray Urena? Do you have a question? Going once. Watch Fox, go ahead with your question.
So some of the measures that we have taken to provide actually statewide notification of the cases of measles, the outbreak in the upstate include through the media. We have actually sent out communications to the school nurses statewide in public schools, in charter schools, in independent schools, so that school nurses are on the alert to look for to be aware of the potential symptoms, to look for in children or staff who may present with signs of illness consistent with measles. And we also had a press briefing for the South Carolina Association of, the South Carolina Association of School Administrators. So that's the means by which we have a couple of the ways that we have communicated with the schools. And we've also sent out a health alert, making all healthcare providers statewide aware of the outbreak, symptoms to look for, the classic presentation of measles, how to test, and guidance for them to report suspect cases immediately to the public health department so that we can initiate our investigations.
Thank you for that question. I'll check again in on Urana Ray.
Hey, can you guys hear me now?
Yes.
Or no? Okay, perfect. I typed out my question in the chat here, but how does the rate of these cases spreading here in the upstate compare to other outbreaks we have seen throughout the year, such as like in West Texas and those kinds of areas among people who may be unvaccinated?
Well, the comparisons, we have to have a caveat with making comparisons because the transmission of the disease depends on a lot of things, and it depends primarily on the vaccination coverage. And so when we are looking at our cases, we know that all of the cases identified so far are unvaccinated. And we're also concerned that we have seen a declining rate of immunization coverage in the state for all vaccines and as well as for measles vaccine. Other things that contribute to the rate of transmission includes the location, so that if we have congregate settings like a school, if there is poor ventilation in an area where someone who is infected has been, that can increase the transmission rate among those people in the room. And so those are some of the primary factors where we have to be a little bit cautious about making comparisons to the transmission rate in other locations. But what we do know is that with a single measles case reaches an unvaccinated population, as many as 18 to 20 of those who are unvaccinated, I will say that will be transmitted to about 18 to 20 additional people. And another way to think about that is about 90% of the people who have been exposed to a measles case will get measles infection.
Christina Thacker, go ahead with your question.
Hi, good afternoon. You mentioned at-risk children who are exposed are being excluded from school. Now, is this a requirement for unvaccinated children to stay out of the schools, or is it by choice of the parents?
The school exclusion is required. For the incubation period, the total incubation period of 21 days is the maximum incubation period. Because of the risk of someone developing infection and developing early symptoms that may not be recognized as measles before spread can begin, is why we have these exclusion criteria to prevent additional spread in the schools from someone who may develop symptoms that are not recognized as being measles through the entire incubation period.
Thank you for that question. Julia Keener, go ahead with your question. Julia, you're still on mute.
Can you hear me now?
That's good. We can.
Okay, sorry about that. How many hours have you all put into investigating this current measles outbreak alone, and what have been the challenges with this specific outbreak?
Well, I'm not able to specifically quantify the hours, but what I can say is from the initial report of a suspect measles case, we initiate our investigation with a team of people that can include our frontline epidemiologists who make immediate contact with the cases, to interview them, to find out about their activities, about their close contacts, whether that is within their households, other activities they may have participated in the community, in the schools. We often use our DPH healthcare providers to assist in collecting specimens. We can get those specimens very promptly to our public health laboratory. That gives us a very rapid turnaround time. So we have staff in our laboratory who are working. We have, in addition to those frontline epidemiologists who participate in the investigation, we have other epidemiologists and data managers who are compiling the information about the investigation to make sure that we're keeping everyone aware, that we're monitoring this. We have others on our communication team who are helping develop the the guidance, the communication tools to get that information out. So it is really a very significant response of a large number of people in the Department of Public Health who have been investing these hours since the very first case that we identified beginning just a little over 2 weeks ago now.
Christian, go ahead with your question, sir.
Thank you. So I'd like to know, have y'all identified cases that are suspect cases that haven't been confirmed yet? If so, how many? And then also, of the current cases, are they all kids or are there adult patients as well?
So the confirmed cases that we have been, I've just reported those to you. And beyond that, we do not provide specifics about individual cases that could lead to, that could potentially lead to the identification of individuals by offering more specifics beyond that we have identified confirmed cases.
Christina, go ahead with your question.
Hi, I was calling, I'm chiming in from a health department in your neighboring county in North Carolina. I was wanting to find out if you know the total population of the two schools.
We do know
Ron, again, I was just going to say that, yes, that population, those population numbers are the proprietary information of the schools. They can provide that with you. We don't necessarily have an up-to-date list of how many kids are overall at each school. I would check with them because they keep those numbers up and they know those better than anyone. Skylar, go ahead with your question.
Hey, this is similar to the one that Christian just asked, but I just wanted to know if you can give a number of cases that are associated with the schools, or if it's been all of the 7 identified with the outbreak so far.
Let me just have you repeat
Chiming
your
in
question,
from a
please,
health
make sure
department
I'm
in your
clear what you're
neighboring
asking.
county
I
in
just
North
wanted to
Carolina. I
know
was wanting to find out if you know the total population
the number
of the two
that are
schools.
students at the schools, or if you can say,
We
people
do
at
know
the
the-
schools.
Ron, again, I was just going to say
the
that,
full
yes,
7
that population,
associated with the
those
outbreak that have
population
been
numbers are
confirmed,
the
or if there
proprietary
are
information of
other
the schools.
cases
They
in there
can
that are
provide
not
that with you.
from
We don't
within the schools, if
necessarily
that
have an
makes sense.
up-to-date list of how many kids
So
are
the case
overall
numbers
at
that
each
we're
school.
reporting
I would
are,
check with them because they keep those numbers up
are
and they
of
know
this
those better than
outbreak, and
anyone.
we will not
Skylar,
drill
go ahead with
down
your
to
question.
provide whether or not specific cases
Hey, this is
are
similar
associated
to
with
the one that
school
Christian just
or in the
asked, but I
community.
just wanted to know if you can
And
give
you can
a number of cases
follow
that
up with
are
us if I'm
associated
not,
with the
if
schools,
I'm
or if
not
it's
exactly
been all of the
answering that
7
question. But
identified with
again,
the outbreak so
we
far.
want to make sure that we do not provide
Let me just have
information
you
at such
chiming
a
in
level
from a
that
health
the
department in your
population
neighboring
that lead to
county
the identification
I
in
just
North
wanted to
Carolina.
know
I was wanting to find out if you know the total
number
population
the number
of the two
that are
schools.
students at the schools, or if you can say,
Hi, thanks very much.
people
do
at
know
the
the
schools.
I was
Ron,
wondering,
again, I was
given
just gonna say
the
full
size of
7
Yes, that
associated with the
population, those
outbreak that have
population
been
numbers
the
confirmed,
are
federal government for help,
or if
proprietary
there are
information of
other
the schools.
cases
They
in there
can
that are
provide that
not
with you.
from
We don't
within the schools, if
necessarily
that
have an
makes sense.
up-to-date list of how many kids
So
are
the case
overall
numbers
at
that
each
we're
school.
reporting
I would
as
check
part of
with
the
them because
national
they keep those
surveillance
numbers up and they
part
know
of
those
this
better than
hour,
anyone.
we will not
Skylar, go ahead with your
to
question.
provide whether as we routinely do specific cases.
Hey, this is similar to the one that Christian just asked, but I just wanted to know if you can give a number of cases that are associated with the schools, or if it's been all of the 7 identified with the outbreak so
I want
far.
to make sure that we do not sure that we have adequate vaccine inventory in the state to provide to those who are not immune.
Thank you for that. Lauren, go ahead, ma'am.
based on the numbers that you were citing earlier about the ease with which this is transmitted, you all are probably expecting the number of cases to grow significantly. Out of this 153 unvaccinated students who are exposed, how many might reasonably become sick based on the numbers that you gave us?
Yes, it is a concern, and that is exactly why they are excluded. Now, the risk of each of those actually developing infection could determine how close of a contact that they had. So we do rely heavily on the schools to provide us as specific information as they can about the activity of any cases within a school, so we can really get the best understanding of who the direct contacts are, the close contacts are, and those who shared airspace. If each and every one of them had significant contact, and again, we have to be as safe as possible to make sure that anybody who is susceptible and has been in those areas, but in a school population, you can imagine with the moving from room to room, moving through hallways, it's not easy to identify the specific degree and duration of direct contact that could lead to some being at higher risk of developing disease than others who still fit the definition of exposure. But the concern is that for any who have had close contact and are not immune, as many as 90% of them can become infected. And for this reason, it is really important for us to get our immunization rates up as quickly as possible. Another point about the necessity of the speed of initiating these investigations is that if we can get close contacts vaccinated within 72 hours of the contact, then they can be protected and they can actually return to school. Vaccination beyond this period of 72 hours is not known to be effective in preventing subsequent infection.
Thank you for that. Christian, go ahead, sir.
Thank you. So when the Department of Public Health first announced this, it said that it was centered around a school, and we know now there are 2 in Spartanburg. So can you tell me which school was the first to have a case? And also, do y'all have an idea of how bad this could eventually get now that we have a case in Greenville too?
Well, I guess the sequence of which school we identified first or second, we have released the names of the schools, and that's really the most important thing, and that we've made notification within the schools. And I'm so sorry, can you repeat the second part of your question?
Yeah, so the second part was, do y'all have an idea of how bad this could get? You'd mentioned the 90% number. So that seems, considering that, I think you said earlier, there were 153 that had been unvaccinated that had contact with someone. So now that it's in Greenville too, do you have an idea or projection of how bad this could get like a month from now?
Well, I would say the worst case scenario is that of those who have been identified as exposed, that about 90% of them could become infected.
Christina, go ahead with your question.
Hi, yes. At what point would the department step in and actually close a school? Is there a point that health officials are concerned that exposure rate or infection rate is too high and a school would have to close?
So those are decisions for the school. The Department of Public Health does not make determinations about school closures. It's up to the schools to decide how they can best operate and how they can continue to provide an adequate learning environment.
Urana Ray, go ahead. And I apologize if I'm.
It's backwards. It's okay. It happens. But thank you for getting my last name right. So when it comes to all this, do we know just a couple of things? Do we know where the Greenville County case originated as of yet? And is the DPH going to recommend any booster vaccines or any of these sort of vaccines, extra shots to help protect kids who may be more vulnerable to infections, such as children with special needs or medical conditions?
We are still currently investigating the case that was just reported to us, so we don't have additional information about that. Booster doses for the MMR vaccine are actually not recommended. So beyond the schedule, the recommended schedule that I provided, that children receive their first dose of the vaccine at 12 to 15 months of age and a second dose at 4 to 6 months of age, offers about 97% of the people who receive the recommended 2 doses lifelong immunity. And for that reason, unless there are some special circumstances, booster doses are not recommended for the MMR vaccine. A special circumstance might be that if someone has only had 1 dose, and they may be traveling to an area where there's a high degree of transmission, they should consult with their healthcare provider and look at the travel advisories to make a decision as to whether or not a second dose might be indicated for someone who might have inadequate immunity and is traveling to an area with known high degree of transmission.
Lauren, go ahead with your question.
Hi again. Are you at all concerned about compliance among parents or school leaders in terms of working with DPH to contain this? Are you worried, for example, that there could be unreported cases out there?
So
because of skepticism, for example, among families who may be reluctant to interact with the health department.
Well, sure. Well, first of all, with regards to the schools, we know that the schools are very invested in preventing disease transmission in their facilities. And so we very much appreciate the school's cooperation with our guidance to help us identify cases in the school and to work with us so that we understand where any case that has been confirmed has been in the school setting, as I've mentioned, classroom schedules, activities, airspace. And so we do heavily rely on the school's cooperation with providing us all the information that we need to track where this virus may have occurred and who it may have exposed. As far as the families, we provide, in these notification letters, we provide our recommendations about our guidance, rather, about what they must do to prevent spread in the community. So when we make a recommendation or provide guidance that someone must be in quarantine if they've been exposed and they're not immune, then we really rely on these families to comply with our guidance to make sure that even if they're excluded from school, they're still not out and about in the community. And compliance is very important with supporting our prevention of ongoing spread in the community. So we just implore those that we've provided our guidance to follow our disease prevention recommendations.
Thank you. Deidre.
Thanks again. I was wondering if you had an update on maybe how many vaccine doses you've given out since the outbreak was announced, since there has been this additional push to raise vaccination rates.
Yeah, so this has been actually a relatively short time since we have made announcement of this outbreak. And most people might have a routine clinic appointment. At this time, while we are and we'll be monitoring any increase in uptake of the MMR vaccine, we don't have any specific data now and a change in uptake from when we first made this notification to now in terms of more people getting vaccinated. But we will be working with the schools and working with communities to meet any needs that are made known to us through the use of our mobile health units. We plan to have community immunization services provided where there's a high demand, particularly if there are areas where there is limited access to immunization services, and those are some of our goals. And we're actually evaluating now where the best place would be to provide those mobile vaccination services in addition to the appointments that we have available in our Department of Public Health clinics, but we also advise people that vaccines are available from their healthcare providers, in pharmacy chains, and so we do strongly encourage people to seek out all the potential places that they could get vaccinated as quickly as possible.
Christian, go ahead, sir.
Forgive me if you already answered this. The Greenville case, was this related to someone being in contact with someone infected in Spartanburg, or is it unrelated to the Spartanburg and it's just geographically close?
So we just started our investigation of this case, and at this time we don't have any information if there is any common source of exposure with the Greenville case to the known cases.
And Skylar.
Just two quick number questions for you. Do you have any number of students who potentially got a vaccine within that 72-hour window after exposure? And are you able to break down the number of students who were exposed by the two different schools?
I don't have any information about anybody taking advantage of vaccination within 72 hours. And nor do I have additional information about the breakdown within the schools.
All right, we are almost at 1:30. Are there any further questions for Dr. Bell today?
I have one more, I'm sorry.
Sure, go ahead.
Have there been any contacts that have been identified in other surrounding states or counties?
We are not aware of cases in other jurisdictions associated with our cases in South Carolina.
Thank you for that question. Yeah, Lauren, go ahead. And
One last question, I promise. Yeah.
Sure.
What about siblings who are in these homes where the 153 unvaccinated exposed students are now quarantined? Have you identified the number of family members that could be in contact with these students now? Just trying to get a sense of how big this web is.
Right. So again, we don't discuss the direct relationships, but what we do is we investigate all potential close contacts, whether they're within the household, in the community, in the school setting. And that is what frames our understanding of who is in close contact or is in an area of shared airspace. And then among those close contacts, we evaluate their immune status. Who among them have been vaccinated and are immune, or if they're not immune, then that's how we make the decisions about who should be excluded and who should be quarantined. But beyond that, I would say that our contact investigations involve anyone who could potentially be exposed and at risk.
Can I just ask a technical follow-up question? So for example, let's say that you have a student in a classroom with someone who tested positive. And so I imagine the students in that classroom would be a close contact. If they go home, and are there other family members who are unvaccinated considered close contacts at this point? Even if I'm just trying to understand. I'm sorry.
No, and I understand your question better now.
Okay.
The close contacts are not infectious. Although they're exposed, we put them, we require that they go into quarantine so that they monitor for symptoms of illness. While they are not infectious, that does not mean, so because they are not infectious, this means that their contacts are not at risk of developing disease because they don't yet have disease. They just must be monitored for symptoms of illness. Should those symptoms develop, then we ask that they be evaluated, get tested, and if they do have measles, then their household or other direct contacts become at risk of spread. So thank you for the question. I understand now what you're asking. It's important to make the distinction that cases are infectious, contacts are not, but they must be monitored for symptom development so that we can catch them as early as possible before they start spreading to others once those early symptoms develop. So sorry if I didn't understand the question.
I was probably unclear the first time anyway, but thank you. I appreciate it.
And our last question of the day, Christian, go ahead.
Thank you. So earlier you had mentioned possible vaccine clinics. Would these be free to the public or would they have to pay?
The Department of Public Health will be prepared to provide vaccinations to anyone who needs them, regardless of their ability to pay.
Thank you for that answer. And to Skylar and Judy, I'll email you guys offline. Thank you to everybody who participated today. We very much appreciate you being here and being able to and present to cover this important information. copy of this today's recording will be provided on our YouTube website. We're very thankful for all of your participation today. Thank you, Dr. Bell, for the briefing. If you have any further questions after this, please email me at media@dph.sc.gov, and I'll be happy to respond to you. And I wish you all a fond rest of your Friday. Thank you.
Thank you, everyone.